Good morning, everyone. Yesterday we did the first developmental checklist, going up 1 month and 2 months. This is a checklist to use by 4 months of age, does your child. Again, this is published by the Nipissing District Developmental Screening Tool, ndds.ca, if you'd like to look it up. And it's a simple developmental checklist meant for families, child cares, caregivers, grandparents, aunties, uncles. It's just a simple way to check, is your child meeting all the milestones? If they're not, then it's great to go and talk to your pediatrician. What it says at the bottom of this is, if you answer no to any questions or you have any concerns about your child's development, follow up with your health care or child care professional. And so it's not a worry that they're not, it's just a way to check in and make sure that things are developing the way they should be. Some children need a little bit of encouragement or a little bit of help, and your own doctor, your pediatrician, is the best person to give suggestions for this. So first, by 4 months of age, does your child follow a moving toy or person with his eyes? So if a toy is moving, will he follow looking for it? Glance from one object to another. Make some sounds when looking at toys or people, so react to something. Brighten to sounds, especially people's voices. Will he look a little? Respond to you by making sounds and moving her arms and legs. So when she sees you, does she make some sound and move her arms or legs? Laugh and smile in response to your laughs and smiles. So if you're smiling and laughing, does she respond to that? Finish each feeding within 45 minutes. Lift head and chest and support self on her forearms as the baby down at the bottom is doing. So can your baby do this by 4 months of age? Lift head and chest and support self on forearms when placed on tummy. Bring both hands to chest and keep head in midline when lying in back. So this position here, is your child able to do that when lying on their back? Hold head steady when supported at the chest or waist in a sitting position. Reach for an object when supported in a sitting position. So if you're sitting your child on your lap and supporting them, do they try to reach for an object? It's not that they're going to get it, it's that they're attempting. And then hold an object briefly when placed in their hand. So if you place a small object in your child's hand, are they able to briefly grasp it? If your child's doing all these things, that's super. If they're not, that's the time when you go for a well baby checkup, or just to phone your doctor and just have a little check-in about, should there be some things that maybe I'm doing that I'm not? Is there something I can do to encourage my child? For example, this position here, if you're not giving your child enough tummy time, you may find that they're not able to support themselves on their forearms because they're not used to being on their stomach and developing those muscles. So it's a little check-in. It's an easy list. We'll continue on tomorrow. So this is by 4 months of age. And as I've said, ndds.ca, you'll see the whole developmental screening tool from 0 to 6 years of age. And it gives you that opportunity to just do a little check-in, especially as we're not always around as many people as we used to be right now. And so sometimes it's hard to know, is our child developing up to their milestones, or do they need a little help, a little support? Okay, bye everyone.